Hello, and welcome to an introduction to electronic charting. During this DVD, we will look at what is electronic charting, the standardization of nursing language, interoperability, privacy, glitches, and the future of electronic charting. First, we have Liz, an ER nurse at the North Bay General Hospital, who is going to tell us what electronic charting is.
After maintaining paper records for decades, healthcare has embraced digitalized health information systems to better manage patient care and trim costs. Electronic charting is charting using electronic health records to document your assessments. Electronic health record provides a real-time access to information among clinical care providers, hospital labs, and pharmacies. Electronic health records' goal is to have a single medical record for each patient that is accessible anywhere, anytime, across the continuum of care. It enhances patient safety and the ability to document and quantify improved outcomes. It is a dynamic, simple, easy to learn and use program, and is becoming a workplace reality for nurses and healthcare providers. Electronic health record has the advantage of capacity for data interfaces and alerts, improved interdisciplinary communication, evidence-based decision support, forces better documentation, and reduces incidence of med errors. As much as $35 billion in savings comes from electronic charting. It reduces the hospital lengths of stay because the workflow features found in electronic records systems can better coordinate the care of patients suffering from chronic diseases.
Now, Dan, a palliative care nurse at the North Bay General Hospital, will tell us about the standardization of nursing language.
When discussing electronic charting, it's important to establish a set of standardized terms which can be broad enough to facilitate accurate data collection while still allowing the nursing staff to report specific adverse findings. Currently, in paper documentation, flow sheets and other records are developed by department-specific program managers. Many times, there are different forms that convey the same information in a slightly different way. If nurses in various units or hospitals are documenting the same information, it may appear to be different data because different terms are being used. Nursing needs to use the same terms across the profession so that we can perform research, better define our practice, and document the effective nursing care on patient outcomes. If we as nurses do not make a decision to standardize the language that we use, we run a great risk of being told what language we will have to use. Now, although more work needs to be done, at the North Bay and District Hospital, we're beginning to see evidence of standardized language through the adoption of the DAE charting methods, along with the foci that are standard for charting.
Next, we have Michelle, a maternal child nurse at the North Bay General Hospital, discussing interoperability and electronic charting.
So what is interoperability? It's the ability of two or more healthcare systems to transmit and receive information within and across organizational boundaries to provide the delivery of optimum healthcare to individuals and communities. Okay. So how does this apply to electronic charting? You can walk into your client's room, do your assessments, and then go to the computer in their room to chart your findings. You can also see if there are new orders from the physician. You update your client's chart and your findings are automatically saved for the physician, the lab, and any other healthcare professionals collaborating in the care of the client to access later on. Kitchen staff can receive updates to any changes to the client's diet. Lab tests that are ordered by the physician and results are automatically integrated into the client's electronic health record for you to view. Anything that is charted outside the normal range is brought to the attention of any healthcare provider it applies to. Interoperability translates to many benefits for the client. It preserves the meaning of information and data when it is shared. It provides real-time exchange of vital patient information that can impact quality and safety. Health information can be exchanged and is portable and available to his or her clinicians to the extent that he or she wants it to be. The client can move more easily between and among clinicians without fear of their information being lost. Increased choice, portability, and control are also great benefits for the client. Interoperability also translates to benefits for the healthcare team. There's greater communication. Physicians can access a client's chart from their office to review the status of their client or have a comprehensive health history of their visit to the hospital, a walk-in clinic, or other healthcare professional's visit. The information that is needed to organize and plan health services is collected from administrative systems and surveys and brought together to create useful measures for policymakers and managers. Interoperability translates to benefits to the community, the province, and the country. National health statistics rely on comparable and consistent data. Computer systems are considered semantically interoperable if they facilitate the coding, transmission, and use of meaning across seamless health services between providers, patients, citizens, and authorities, research, and training facilities. A study by 6 American authors explored the economic implications of healthcare information exchange and interoperability. Interoperability between clinicians and external laboratories reduced redundant tests, delays, and costs. These savings would produce an annual national benefit of up to $31.8 billion. Interoperability between clinicians and external radiology centers would reduce redundant tests, save time and costs associated with paper and film-based processes. These savings would produce an annual benefit of up to $26.2 billion. Provider and provider connectivity would save time associated with handling chart requests and referrals. These savings would produce an annual benefit of up to $13.2 billion.
Amy, a pediatric nurse, will now tell us about privacy issues and electronic charting.
Electronic health records appear to present new threats in maintaining the privacy of patient-identifiable medical records. Because an electronic record can be called up instantaneously by someone with access to the data system and the relevant passwords, and can more readily be widely distributed, patients and healthcare providers alike fear that confidentiality will be compromised more easily by sources both within healthcare and outside of the system. The access to these confidential and sensitive documents is ruled by government law, specifically PIPEDA, which stands for Personal Information and Electronics Document Act. This is a Canadian law which governs the collection, use, or disclosure of personal information collected through commercial activity, includes the health records acquired and kept by the hospital. The law gives individuals the right to know why an organization collects, uses, or discloses their personal information, and expect an organization to do this reasonably and appropriately, not using the information for any purpose other than that to which they have consented. An individual can expect the personal information to be accurate, complete, and up-to-date, and have the right to obtain access to their personal information and ask for corrections if necessary. And an individual must also expect an organization to protect their personal information by taking appropriate security measures, and has the right to complain about how an organization handles their personal information if they feel their privacy rights have not been respected. The law requires organizations to obtain consent when they collect, use, or disclose personal information, and they must also supply an individual with a product or service even if they refuse to consent for their information. An organization must collect information by fair and lawful means and have personal information policies that are clear, understandable, and readily available. Exceptions to this include investigations related to law enforcement or in the event of an emergency. When you are charting electronically, the first thing to remember is that while documenting electronically will clearly feel different than documenting on paper, the principles remain the same. Health records are always considered as legal records of care or service, and thorough, accurate documentation in any form is one of the best defenses against legal crimes. Safeguarding confidentiality is always of utmost importance for registered nurses, and here are specific guidelines to help protect your client's personal information and protect yourself. Never reveal or allow anyone else access to your personal identification number or password. This is your electronic signature. Inform your manager if you suspect that someone other than the individual to whom it was assigned is using a particular personal identification number. Change passwords at frequent and irregular intervals.